I couldn't do anything. But now I want to change that and see myself in a better way, in a better life.
It makes them want to strive to do as well as they can, and Living Learning does an amazing job of doing that kind of support.
What we do at Hester Hornbrook Academy with Living Learning is ensure that those wraparound wellbeing supports are provided so that any barrier to education is removed.
Melbourne City Mission's strategic objective is to lead through innovation. To do this, we identify gaps in the service system for young people. We design pilot programs at our school, Hester Hornbrook Academy, and then we gather the evidence of what's working.
These programs bring together government and NGOs in a partnership.
Our philanthropic partners are Gandel Foundation, Lord Mayor's Charitable Trust, Paul Ramsay Foundation, the Helen McPherson Smith Trust and Ross Trust. And we couldn't bring a social innovation project like this to life without the support of philanthropic partners.
So bringing in those investors into the project gives us that scope to really try new things and have the confidence in ourselves and do innovative things as we go.
Wellbeing and learning goes hand in hand to ensure that a young person can travel to school, they have the resources for learning, and all of those wellbeing supports and strategies required are in place.
And we're looking forward to coupling that with advocacy to see a systems-wide change to how we support young people with mental health conditions in education.
I love my job because I feel like we make a real difference to young people.
I feel like we're real. I think we're relatable, and I think the young people love that.
You end up becoming so close with your key worker, they are there. You can reach out to them at any time, and I'm really grateful for everything she's done. She's so welcoming and caring, and I wouldn't be the same person without her.
An innovation, and where I think youth services needs to go, is to be trusting in the young people to follow their lead, to empower them to make decisions for themselves.
So what we have designed and what we do is that we're all about relationships, developing really high quality relationships and trusting relationships.
A lot of our young people have been let down by a range of systems and supports in their life. I think what we do really well is support them to rebuild.
When I was growing up, I think no one really cares for me. No one was there when I needed someone, and you guys provided that for me. You guys gave me a shelter of sorts to make me feel good about myself and make small changes, small improvement in order for me to better myself.
For us to reach these people, for them to trust us, we have to go there and we have to be authentic in their lives, in their spaces.
We are really, really aligned with their goals, whatever they might be, and supporting them. And I think that's why we can make a difference in this program.
Education doesn't happen in a silo. It's not just, it's only one piece of the puzzle.
We've designed the project to have an educational element, a social work element, and an allied health element.
So I think working with a psychologist, for example, who has that real deep understanding of long-lasting symptoms of, historic trauma or different diagnosis, is empowering as a teacher.
I hadn't been in school for a few years, and it was kind of depressing being home all day. So it's just really nice to get back into that kind of environment. After having the proper kind of support, it started becoming easier having people there. They kind of try seeing what's your ups and downs and try tackling that. It can be hard to seek out that kind of help, I guess. And when you do have it, it is positive and reaffirming.
So with Living Learning, we've been able to provide evidence-based literacy and numeracy targeted interventions to our young people. We use data to identify those skill gaps, and we're then able to look at their data, and if they haven't improved, we can start them down the life-changing course of some diagnosis of learning difficulties. So if it is just a skill gap, they've now got those skills and they can proceed with the rest of their education. And if they do have some higher needs that are going to require some more intensive support from psychologists and education experts, they're now down a pathway where they can get that. Either outcome with interventions is an absolute win.
I think young people need to know that they're supported by people that understand them. Our primary goal is to help them re-engage with school and education and positive pathways in their life. I guess really strive to make young people see that there is hope.
We try to work really collaboratively with the school and with the key workers in our team to make sure we provide the best well-rounded support.
It's good to get the help that I need, or try and find the help that I need, being someone who's autistic.
What I do is what's called multimodal creative arts therapy. It enables the students to move through what's going on for them. They might bring in something that's bothering them. They might come in a fantastic and playful mood. They might come in with a buddy. They might come in very quiet and reflective. And so we work with what's there for them. What was so extraordinary was the calming impact of spending time absorbed in simply doing and making, and that the students have space around things for a period of time in a world for them that can feel really overwhelming, really busy, really intense.
My role really is to engage the young people in moving their bodies however I can. A lot of the young people at school have come from perhaps negative experiences with mainstream schools. So really what we offer is a sort of trauma-informed approach that's really about creating a safe place where people feel comfortable to just experience exercise, movement, and all of the restorative things that can bring to a young person and their life.
So when I joined Wild, I was not a swimmer. I used to be afraid of water. And then all the activities were like water activities, And then last year, I just set a goal, I need to swim. I need to know how to swim. But now I can swim, and I'm very confident. It is a motivational sort of program. It makes you try out new stuff, meet people. It takes you out of your comfort zone. It makes you just challenge yourself, how to be more independent as a person,
So the Living Learning Program and Hester Hornbrook Academy has had a positive impact. It's a social impact bond that really does lead to positive outcomes for young people.
The time that a young person spends in living learning, we're gathering a lot of evidence around their experience and what's working for them. And we're able to demonstrate that young people have reduced hospital usage. They've got increased attendance at our school, Hester Hornbrook Academy. They're increasing their literacy and numeracy, and a lot of the wellbeing measures that we track are all showing really positive outcomes. Things like improved relationships, a sense of wellbeing and happiness.
More than 40 of the cohort 1 of our students are going on to post-secondary education or employment. And I think that just shows you how important it is for wellbeing and learning to coexist in one educational setting, and that young people who have been disengaged can learn and can have positive outcomes.
And that is it. That is what we want, that the young people are seeing themselves as having a positive future, and that's all we can do.
I don't think everyone realises they need it, but once it's there and you've got it, it's a whole different experience altogether.
I'm absolutely privileged and proud to be part of this project where we have broke that new ground and we've proved this project is working. We've done something that nobody's ever done before.
I didn't think I would make it past 18, so I'm very grateful to everything Living Learning has done for me.
How I describe living learning is, in my life, that it is life-changing. It's incredible.